All right, hello everybody. I am joined by pulmonary critical care and sleep physician, Dr. David Rosen, who's in New Jersey and on the front lines. I had technical difficulties with audio today. That seems to be a trend, but it's only our third day. And David, thank you for being here, for being my fourth interview. It's a pleasure to speak with you.
Thanks for having me.
Absolutely. So, let's just jump right into it. Like everyone's interested. I'm interested. What's life like on the front lines as a physician in New Jersey?
So it's been kind of an evolution of adjustment. It was just a slow realization that this is really going to hit us hard. And eventually, my experience in my hospital, you could just see the incidence rate, the people coming in with COVID-19 was rising and rising faster, rising exponentially. Lots of emotions with it. It's really, the way I described it to other people is that when you're taking care of people in the intensive care unit, you're taking care of the sickest of the sick. But even with that population in the ICU, there's certainly a spectrum of how sick they can be. And the patients who are the sickest with COVID-19, I would see a patient, when I was doing intensive care work frequently, I would see a patient that sick maybe once every 2 months. And then once COVID-19 really hit us hard, I was having a unit full of those people. So I'm talking 13 people in an intensive care unit, as sick as I've ever seen. Whereas before that, I'd only see a patient like that once every 2 months, meaning you're spending hours on them, on that one patient. Now you have a whole unit full of them. So there's a lot of emotions of dread, of fear, a sense of responsibility. The other thing is even as an intensive care unit physician, you're just not accustomed to having so many healthy people be that sick. A lot of patients who are in the hospital who are sick, they tend to be people who have lots of medical problems, can bounce in and out of the hospital. You don't frequently see people who are fully functional in the community, not lots of medical problems. But with this pandemic, you are seeing people in their 50s, sometimes their 40s, who are fully functional people with families and jobs, and you are seeing them at death's door. And it's a completely different experience seeing someone like that close at the precipice of being near death than the people that we typically see, which is someone in their 70s or 80s, and where it's probably their time to go. And although it's sad for their loved ones when it's their time to go, you recognize that this is a part of life. But for these patients, this is not the way. You recognize this is not a part of life. This is a 50-year-old person with kids and a job and a family that loved them and didn't expect this to happen. So it's a completely new experience. I've been an intensive care physician for many years, over 10 years that I've been in since I was first in the intensive care unit, and I've never had to deal with this kind of experience, these kinds of emotions.
Well, normally we drink on to a good note, but that is a good note. I want to cheers to you and to all our physicians and nurses and healthcare workers and everyone at hospitals and who are taking care of all of us. So I just want to cheers l'chaim to you and thank you for everything you're doing on the front lines.
L'chaim, I'm gonna show off one of my pride. So this is, I'm gonna pour some whiskey in here, but I just want to show this ice. This is clear artisanal ice that I make as a hobby.
I was going to ask, what do you do? So with that serious, situation that you're, l'chaim, cheers.
L'chaim.
I'll drink again. Fine. Okay. Twist my arm. With all that seriousness at the hospital and the situation that's unprecedented that we're facing, but you're facing on the front lines. How do you balance, that with coming home? We hear about a lot of physicians or healthcare workers who, there was an article this week about someone who has an RV outside their home. People are sleeping in the garage. How are you and your family handling the situation from when you take that intensity and then, you're then coming home, you have to unwind, you're a father, a husband. So how do you balance all of that and navigate it?
So I have to be so appreciative of my wife, Sharon, because it's such an emotional toll that it takes dealing with these patients, caring for these patients. And on certain nights, I've really had to lean on Sharon to be there for me, because there's one night in particular where I was there when we ran out of ventilators, and that's like a third world country problem. And I was there when our country, our hospital, actually had no ventilator for a patient who needed a ventilator. So a night like that, I'll never forget. And the next day, I wasn't working, and I was really down. And Sharon was there for me to lean on her as a source of support. And I was even uh, open with my kids, who are young, but they saw that I was sad, and I had to be open with them about why I was sad without trying to scare them too much. So definitely on my side, I was very aware of the risk, of the emotional toll that this could take on me. So I tried to spearhead that and make sure I was leaning on my support system to be there for me. But of course, the toll on the family is multifaceted for frontline workers, because there's, of course, the fear of a risk of transmission. In terms of the risk of transmission, I don't think we have really evidence about what are the best practices. So we're kind of just leaning on intuition and probably erring on the side of caution too much, but you can't blame us for doing that. So what I do when I get home is I get in my garage, I take off my shirt and my pants, I strip down to my underwear, I put my pants in my trunk, I put my shoes in the trunk, the keys, I wipe down my phone, and my nanny gets a show as I walk in my underwear to the guest room shower, and I take a shower, and the kids know now, like Daddy, as soon as I get home, Daddy, go take a shower.
Don't touch Daddy.
So
Don't touch Daddy.
yeah. So it's scary, and we have a newborn. She's 10 weeks old, and God forbid, what if I could transmit that to a newborn? We don't know the risk of that. And you hear stories of other families where the frontline worker just goes to a hotel. It's just not feasible for me to do that. I need to be present as a dad when I'm not working. So
Of course.
we've felt satisfied with me doing that, just kind of the decontamination procedure as soon as I get home, and to be very diligent about that. Is it overkill? Possibly. But we're just being extra cautious. That's part of why I shaved my head. Not that there's any evidence that one should do that, but I needed a haircut anyway, and there's no one to cut my hair. So I was like, well, I might as well shave my head. Maybe that would make things more sanitary for when I'm in the hospital. Even though I wear kind of like a surgical cap when I'm in a COVID unit.
Is it true that that the more you're exposed to the virus, the higher the viral load, and that's something that's why physicians and healthcare workers are getting more likely to get sick, or and can you bring that home to your family?
I'm not aware if we have any evidence of that, but that certainly is a concern to me, because you hear about, that doctor in China who kind of blew a whistle on this was a guy in his 30s, an ophthalmologist in his 30s. Mm-hmm. Why would that guy have died? And you wonder if he was just kept getting exposed to the virus by all his patients, that perhaps that played a role in him having such an overwhelming response to the infection. But I don't think we have an evidence-based answer to that, but we're all just being extra careful, making sure that we have PPE at all time. And it's kind of the astounding, the evolution of this. When this started, as we first started getting the cases, just like the CDC, we were just like, okay, wear a mask when you're around, but to wear a mask in the hospital, seems to wear a mask in the hallway when you're not in a patient unit just seems like such a silly idea with no evidence to back it up. But as the reality hit of all these healthcare workers getting sick, we just said, forget evidence. Like, let's just go to the extreme here, because we don't want to put people at risk.
Yeah, when we went to get tested here in upstate New York, they had an under mask, an over mask, another mask over that, and then a shield. So I mean, but again, like, you're on the front lines. Like, you deserve to be as protected as you need to be. And I have heard that the CDC, made that recommendation because they were, trying to save PPE, for healthcare workers. And I think that was the right decision. I mean, there are lots of things to criticize, but I think that you guys on the front lines deserve it and should first and foremost be protected. And so before we, I want to, since we're on this, it's obviously, a serious topic, and you're on the front lines, and, I appreciate you taking time on your day off to, talk about this. What do you think, in your estimation, it'll be a two-part question. Like, in your estimation, when do you think the peak was in New Jersey, or do you think it has passed? Are we at a plateau? And do you think, like Dr. Fauci has said on multiple occasions, and others have said, that, we will have therapeutics and, some ways of treating it will have more of a recognition, an idea of what to do with the disease, but that there will be a second coming of Corona next fall, or this coming fall?
Well, the peak depends on where you are. So I think in my area, which is North Jersey, we've absolutely peaked. New York City has absolutely peaked. We've been on the downslope for a couple of weeks now.
And you're seeing that both in news reports, but you're seeing that on the front lines in the hospital as well, correct?
Absolutely, absolutely. A few weeks ago, I had that night that I'll never forget. I put 5 people on a ventilator that night. I've never had a night like that. Maybe two people on a ventilator pre-COVID would have been a night worth noting. But 5 people, that's unprecedented. Now I've had a couple of overnight calls where nothing happens, where everyone's kind of tucked away and you don't get any real emergencies. So without a doubt, it's peaked. And
it's fantastic to hear. I mean, thank you.
Yeah. So thank God. And, I think we owe that to the social distancing and the lockdown, that has been sustained. So we've peaked in our region without a doubt. I hear South Jersey is having more is having a rise in cases, but definitely in my region, North Jersey, New York City, we've absolutely peaked. In terms of how it's going to play out, no one knows for sure, but I think definitely the messaging needs to get out there. People really need to internalize that just because we peaked, just because we're on the downslope, doesn't mean there won't be another outbreak. And I think, honestly, it's hard for us to put our head around that, to really internalize that. I know it rationally, but I can't really emotionally accept that we're going to have another outbreak in a few months. But logically, we have to accept that. And it's not just COVID that this happens with. The flu season is not one peak and then a downslope. People may not realize the flu season actually has 2 peaks. It peaks in like January time, and then goes down. But like April time, it starts peaking again. It starts going up again. So without a doubt, we have to be prepared for another outbreak, another rise in cases, and make adjustments to our policies based on that possibility and probability.
That's it's tough to hear, but also very realistic, and I think it's important for everyone to know, because I find that I've been reading a lot about folks that are, it's coming down, we're good, rah rah, let's open up the country. I've been sitting in the same house for 6 weeks. Everyone's been doing the same thing, as my wife keeps reminding me. Everyone's doing that globally. We're all frustrated, but I think that there's a line between being responsible and irresponsible, and wanting to get the economy open. And I think that hearing from folks like you on the front line and who have real knowledge about, the disease it's super important, because then we can make a rational and smart decision that won't be, us trying to please ourselves in the short term, but, have long-term, we're preventing long-term ramifications as well.
Yeah.
So I want to transition and there are a lot of tools and things and new things that we're learning about that when I was sick a couple of weeks ago, Dr. Rosen and I were both Sabbath observers, and it's not usual or typical to get a call from me on Saturday morning, but in the midst or early in the days of me having the virus, I called Dr. Rosen and in a tizzy and freaking out, and luckily calmed me down. But one of the things that you told me to get was one of these guys. So I wanted to know if you could talk about what this is, as well as hopefully my numbers are okay.
Right.
I was worried about audio, so I assume my blood 100. No,
Wow.
on top line. Yep, not good. Yeah.
You need to do some meditation. You got to get that heart rate down.
Exactly.
Yeah. So that top number is your heart rate. So how many times per minute your heart is beating. Normal is like 60 to 90.
I'm off the charts, man.
Yeah. And 97. The 97 is your is the percent, your oxygen saturation in your blood. So that you see a little light when you open that up. You see a light coming that goes through your fingernail bed. So that gizmo is able to measure the absorption of that light in the blood. And on the other side, there's a monitor that can measure the absorption of light, and based on that, it can assess the saturation of oxygen in your blood. So it's definitely a handy tool, and of course hard to come by, like cleaning supplies, etc. But I was just telling a patient yesterday who was in the hospital, feeling ready to go home, but needing a bit of oxygen. And I said, if you can get your hands on a pulse oximeter, that'll be a good way to gauge how you can do with walking, and whether you can tolerate walking with oxygen, when you need to come off the oxygen. So it's definitely a helpful tool, and of course, in short supply. And it's pretty cool that they're very affordable, like $20.
Yeah.
Years
I
ago.
paid 50, so I'm gonna return it. No.
Yeah.
What are the numbers you're looking for on this, especially with the since oxygen is a problem, people are going on ventilators. Like what like as a pulmonary expert and critical care expert, like what are the numbers you're looking for? When should you immediately go to the hospital? When should you stay home? What are the numbers?
Normal oxygen saturation is going to be 95% and above. If you have COVID, you should be totally fine with 92% and above. And below 92%, you might want to start being concerned about whether you need oxygen. But it's also how you're feeling, if you're feeling short of breath or not, because there's a lot of complexity with this disease. Some have said we're focusing on the wrong organ. It's not a lung problem, it's a blood problem. And it's a problem where the blood is not absorbing oxygen properly, and not necessarily a lung issue.
Like an altitude sickness or something like that, right?
Right. But clearly it's not one thing. There's what they call, there's different phenotypes of this. There's lots of different ways of presenting with this. So if I had a person who was 89%, but carrying on a conversation with me, I wouldn't necessarily say they have to go to the emergency room, but they should be ready to go at a moment's notice. You got to take it case by case. But the scary thing about this disease is that you can deteriorate rapidly. And that was really what threw us for a loop when we first saw this disease. You would have someone in the hospital needing no oxygen, or maybe a little oxygen, and we'd say, okay, you're fine, you're going to be fine. And 4 hours later, they're struggling to breathe on maximum oxygen, and we're putting them on the ventilator. So that's what people are reading about, what you're hearing called the cytokine storm, where this is just this rapid progression of inflammation that makes your lungs completely shut down. So it's a gamble.
Do you believe in suppressing the immune system in order to prevent that cytokine storm?
We've developed we've increased the amount of tools in our toolbox to combat it. Whether any of those tools help is a matter of debate, and probably going to take tens or hundreds of millions or billions of dollars to really answer the question. But we're using all those tools, steroids and immune blocking medications that cost a couple of $1,000s a pop, to see if it can help. And we think maybe it helps. I've used all the tools that that we have, and it's like every week we have a new tool that we add. Now they're doing a trial just of Pepsid, I think, or I can't remember if it was Pepsid or Zantac.
Acid,
Yeah. So now there's an asthma medicine, Singulair, that they're thinking could help. So we throw everything we can at them if especially these medications are safe. But as to whether or not they work, we're really not sure yet. We're just going based on kind of observations from reports from China, from Italy, and they all seem to say it helps. And then, it's been a couple of times that trials have come out saying that the actual trials that are trying to be better designed, showing no benefit or sometimes even reasons to think of harm. So there was a trial with Plaquenil done at the VA suggesting that perhaps it causes harm. There's some accidental results of early release of results for the remdesivir trial showing no benefit. So there's just so much uncertainty, and it's definitely a good example of the varying trustworthiness of levels of evidence. But we don't have the time or the luxury of perfectly designed trials. We're just going with if it makes sense, and if we have anecdotal or observational evidence to suggest it could help and it doesn't look like it's harmful, okay, we'll try it, because this thing is killing healthy people and killing lots of people. So we have whatever we can add to our arsenal, we're trying to add.
So on that note, and I want this to, it's been a heavier conversation because of, because of your profession, but, on as far as like the general public and people watching, like what should the level of fear be if you get it, going to the store, while wearing a mask and protecting yourself and taking every precaution possible? Like, what do you think the overall level of fear should be?
The level of fear, you really have to respect the lethality of this disease. And I'm not necessarily saying that it's going to be lethal to a 35-year-old healthy person, but there are studies suggesting that 25% of the people who have this disease don't even know they have it, but that means that they could be passing it along to someone else for whom it could be lethal. So we really have to just do everything we can to mitigate the transmission of this disease around, because if we don't practice the social distancing, then it's going to pass around, get transmitted rapidly, and will again overwhelm our healthcare system. We were on the cusp of American healthcare system being overwhelmed and being unable to meet the demand. And I was there when where I was practicing could not meet the demand. And people, I watched as someone died partially because we didn't have a ventilator. So, and it's the lockdown and the social distancing that without a doubt prevented that from happening on a wide scale. So I was saying with one friend, it's like this disease is like Russian roulette, except instead of 6 chambers, the gun has 100 chambers. And it's that 1 in 100 who it's a deadly, scary disease. And 99 out of 100, you're feeling lousy for a week and it stinks, but you get over it and it's fine. And 1 in 4, they don't even realize they had it. So it's just, this disease is just throwing us for a loop every which way. How it can, the spectrum of presentation and infection, every organ it can infect. We're learning now some people can just present with seizures or stroke, not the usual symptoms of shortness of breath. So until we get this under control, which of course what they're saying is 12 to 18 months having a vaccine, we have to give this disease the utmost respect in preventing transmission.
All right. Well,
and I'm not saying we need a lockdown for 18 months. I think it's not realistic. If we're on the downtrend, I think it's reasonable to do the staged reopening that is being talked about, but keeping the social distancing in place is going to be so essential, even when the lockdown is up, to mitigating the transmission and limiting the scope of another outbreak.
So you're saying no Ibiza this summer? Fine. Okay.
Yeah.
I wasn't going anyway.
Right.
Fine. So let's switch gears. We have a few minutes left. I want to talk. I don't know if I'm allowed to talk about this. So we're live. So I apologize in advance. But I know that before the pandemic started and you're totally focused on being on the front lines, you had mentioned to me that you were looking at starting a telemedicine startup, and you'd been talking to VCs and moving in that direction. You're focused on the front lines, but to me as an entrepreneur, business owner, it seems like, it's the time to jump on that. So why don't you, if I'm not in trouble and you want to, share a little bit about the telemedicine startup, as much as you can, and, are VCs still interested? And, you got to jump and strike while iron's hot, man.
Yeah. So pre-COVID, I kind of just got this desire to get into the telemedicine industry. And I eventually decided to leave my job so that I could focus on it. And then there are lots of telemedicine companies out there. I'm looking into starting a company with a very niche focus that I think could really that there's really a need for in the marketplace. And before COVID, telemedicine was a very small percentage of how care was delivered. It wasn't really part in the general public as an option for healthcare. And then COVID hit.
Was that buy-in, or was that HIPAA regulations, do you think?
Why it hadn't been adopted fully?
Why wasn't it the go-to strategy?
I think just inertia. I think it's only a matter pre-COVID, it was only a matter of time before telemedicine became adopted. Probably a big barrier was that insurance companies and Medicare had not yet implemented guidelines and reimbursements that would promote the usage of telemedicine. So that was a significant barrier. A lot of these telemedicine companies, you had to pay out of pocket to use their services, even though it was such a time and cost-saving tool. The incentives were not in place to move it as your first line method of getting care. So I was excited to move forward with focusing on starting this company, and then COVID hit, and then of course I said, okay, I have to meet this demand. I'm an intensive care physician, and lots of these people need intensive care help. So then I just changed my focus and said I have to be an intensivist right now. And in the back of my mind, though, I couldn't help but notice, like, oh my God, this has now catapulted telemedicine into the stratosphere and totally made it a generally accepted mode of delivering healthcare. So definitely that's going to be part of the fallout of this pandemic, is that telemedicine is going to be widespread now. And so many practices had no choice but to adopt telemedicine as a method of healthcare delivery, just to keep their businesses afloat. And of course, and insurance companies quickly said, we will reimburse for telemedicine now. Don't worry about it. In terms of the HIPAA issues, they kind of tabled it, and they're even saying use Skype, whatever you want to use. We'll deal with it later in terms of the HIPAA stuff. So a part of me thought, is this good for my idea or bad for my idea? There's probably, now that telemedicine is kind of front and center, is there going to be a lot more people trying to develop what I want to develop, and a lot more competition? And am I not going to be first to market? I think ultimately it's going to be good for my idea. Because there's going to be increased awareness. And I think my particular skill set and what me and my partner bring to the table in terms of our complementary skills and the way we want to approach telemedicine in a novel way, I think it's going to be an advantage to us, as long as we can execute the idea well and in a timely manner. The timely manner is, of course, the key phrase here, because I have no time right now. I've been doing overnight calls. I've been doing 12-hour shifts in the intensive care unit. And then I come home, and if I'm off, you're never really off because I got 3 young kids to help with. It's hard to kind of say, goodbye. I'm going to retreat into the bedroom and do some work now and work on developing this business when there's screaming kids. So it's certainly a challenge to get it going. And it's kind of been put on the back burner right now. But now that we're on the downslope, I'm certainly, itching to get moving again. And in terms of the interest in the financial community, I actually got put in touch with a VC during the pandemic. I got a lawyer that I'd been working with reached out to me and said, "Hey, I think it would be great if you developed a relationship with this person. He's interested in your idea." So it was really exciting. And this was during the COVID era. And I said,
Wow.
I'm surprised that there's an interest in this, given the impending economic meltdown that's going to happen from this. But I think he realized that telemedicine is going to become such a valuable part of healthcare delivery going forward. So if there's someone who can bring an idea and execute a plan that's going to add a lot of value to that industry, that it could be something that's really worthwhile looking into. So, I mean, my company is still very much in its infancy. The VCs that I've talked to are not interested in incubating my company. They're interested in kind of keeping in touch with me, seeing how I can develop the plan, develop the company. And once we reach a certain level of proof of concept, then they'll definitely consider funding. So we're keeping in touch. I'm keeping them abreast of how things are developing, but honestly, it's slow right now. And I think probably for all companies, it's probably pretty slow because I'm sure lots of doctors, their focus right now is just kind of staying afloat.
Of course, you need you definitely have the use case. It's been proven. So whenever you get to market, I'm sure that the money will be pouring in and people will be pushing the chips to the table.
The evolution of the industry, I think, is going to be very interesting. There's lots of telemedicine companies right now, for general medical care, that you have lots of options. And I think the landscape is going to change rapidly. The way it looks 5 years from now is going to be very different than the way it currently is. There's probably going to be consolidation down the line. But yeah, I find it very interesting how things are going to play out.
I'm going to throw one more question in because I know we're running out of time, but do you think that there will come a time, like you're saying, 5 years from now, medicine will be different? I've been thinking about, like, do you think we could have Bluetooth, like I can have a pulse ox monitor, but this could connect to my Apple Watch or phone. And do you think we'll have a Bluetooth stethoscope that I can hold to the 5 positions or whatever they are? Again, PR guy, not doctor, on my chest and on my back, and then have a bunch of that data or vitals sync up to, get to my physician, in order to diagnose more things without me having to get to come to a physical office.
Without a doubt, that technology is already there, and there are already companies you can find utilizing that technology. And I think with this pandemic, it's going to totally catapult those kinds of models of delivering healthcare into the mainstream. Awesome. Without a doubt. Yeah. And you're going to see lots of companies trying to synergize all these devices that kind of keep their data in silos, and they're going to try and bring them together so you can create a larger picture of evaluating someone's health.
I mean, I'm not a good patient. I'm not good at going to the doctor. So if I could, touch myself a couple of times and you get some information, it'd be great. Do you want to share anything else before we sign off?
I just hope that we can all get through this together, in terms of staying safe, staying healthy, staying mentally healthy, leaning on our support systems, and God willing, however long this pandemic lasts, 12 months, 18 months, with its ups and downs, I hope we can all support each other as best as we can, and hopefully get past this and get through this as soon as possible.
On behalf of everyone that I just want to say thank you to you, to all the healthcare workers, to Sharon and your kids and the families that are supporting the healthcare workers. I mean, it's you guys have tremendous expertise and you've been called into action and in the trenches, and it's really impressive, and and we're very grateful, for all that you're doing. And I, sincerely appreciate you being with me, taking the time on your day off. I know you were just trying to hide in the office and away from the kids, but thank you for, for joining me and for answering some tough questions, but, sharing some amazing information that I think will be really helpful with everyone.
You're welcome. Happy to be here. Happy to talk to you.
Thank you, Doc.
All right.